Good afternoon, everyone. I'm Myron Douglas, a health communications specialist within the Division of Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention. I would like to welcome you to today's Nexus webinar, Set the Table, Improving Restaurant Food Safety Through Science and Practice. There will be a presentation and a Q&A session with our presenters. Our participants joining us today are in listen-only mode. Closed captions are available. Today's webinar is being recorded and will be available online in a few days. You can find the video recording at the webpage link displayed on this slide. After the presentation, there will be a Q&A session. You may submit your questions at any time during the presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen, and then type in your question in the Q&A box. We are pleased to have with us today Dr. Laura Brown, Lieutenant Commander Beth Wittry, and Ms. Thuy Kim. Dr. Laura Brown has worked at the CDC leading the National Center for Environmental Health's Safe Food section. This team conducts research and surveillance on retail food safety and foodborne outbreaks. Dr. Brown has worked on a variety of food safety topics, including ill food workers, hand hygiene, and food cooling practices. Lieutenant Commander Beth Wittry is an environmental health officer in the CDC's National Center for Environmental Health Safe Food section. She oversees food safety research projects to understand environmental factors associated with foodborne illnesses and outbreaks. This research advances science-based prevention and intervention recommendations, enhances outbreak investigation practices, and informs national food safety policies. Ms. Thuy Kim is a PhD candidate in the Division of Environmental Health Sciences at the University of Minnesota School of Public Health. Her research focuses on improving foodborne illness surveillance and outbreak investigation using environmental health data. Prior to returning to school, she was an epidemiologist at the Alabama Department of Public Health, and then a program analyst at the Council of State and Territorial Epidemiologists. Now I'll turn it over to Dr. Brown. Dr. Brown, please proceed.
Thank you. So today, I'm just going to give a little background and overview before we get into the nitty-gritty of our speakers. So next slide. Just going to tell you a little bit about the division that hosts these webinars. This division is focused on improving health by preventing environmental health hazard exposures. These exposures can happen through the air we breathe, the water we drink, and the food we eat. So for example, carbon monoxide in the air we breathe can be hazardous. It deprives us of oxygen. Pathogens like bacteria in the water we drink and the food we eat can also make us sick. So today, of course, we're going to focus on our work in the food safety arena. Next slide. So just a little background, pathogens that live in food, these include bacteria and viruses. They do pose an environmental health hazard. They cause 48 million illnesses annually, 128,000 hospitalizations, and 3,000 deaths. So they can pose a health risk. Now, many of these foodborne illnesses are sporadic. Some of them are linked with outbreaks. An outbreak is a situation in which multiple people get sick from eating the same food. State and local health departments report 800 foodborne outbreaks to CDC every year, and 64% of those are linked with restaurants. Because food served at retail in restaurants can pose an environmental health hazard, most health departments in the United States have staff responsible for the safety of food in these establishments. Indeed, most environmental health practitioners, 76%, have food safety responsibilities. And these responsibilities can vary, but typically they conduct restaurant inspections to make sure restaurants are complying with food safety regulations. They investigate foodborne complaints, they investigate outbreaks, and they also provide food safety training and education to restaurant staff. Now here at CDC, one of the ways that we work to prevent environmental health hazard exposures through food is by supporting these environmental health practitioners and public health departments. And we do that in a couple of ways. Next slide. Today, what we're going to talk about is our work in retail food safety in 3 areas: surveillance, research, and training. Our primary work in surveillance is in the area of foodborne outbreak investigations. We collect data from the environmental health component of foodborne outbreak investigations, and we focus on outbreaks that are linked with retail food establishments, restaurants. And we do this through our reporting system, NEARS, or the National Environmental Assessment Reporting System. Today, Lieutenant Commander Wittry is going to tell you about NEARS and present findings from recent analysis of NEARS data on foodborne outbreaks. Next slide. We also conduct research, and much of this research focuses on best practices in environmental health and food safety. And today we're going to talk about the practices of restaurant inspections, particularly how inspection practices of restaurants relate to outbreak rates. And Ms. Kim with the University of Minnesota is going to present some really interesting findings from our research on this topic. CDC funded this project through a cooperative agreement with the National Environmental Health Association, who partnered with the University of Minnesota to do this work. Excuse me. Okay. Finally, we're going to talk just a little bit about training. We support environmental health practitioners through the development and provision of training. And the training I'm going to talk to you about today is called EAT, the Environmental Assessment Training Series, and that focuses on how to conduct the environmental health component of outbreak investigations. Next slide. Now, before we jump right into our presenters, I just want to tell you that you can find information on everything that we're talking about today on our website. So if you want to scan this QR code, you can find information about our trainings and about NEARS. And also we have summaries of our restaurant food safety topics on this website. You can also sign up for our newsletter so you know when we have new research and other tools available. This newsletter is sent just 2 to 4 times a month. It's not overwhelming. And it's not just about our food work. It covers some of our other areas, for example, water. Next slide. So without further ado, let's get started. I'm going to go ahead and pass it over to Lieutenant Commander Wittry.
Thank you, Dr. Brown. Good afternoon and good morning to some of you. I'm Lieutenant Commander Beth Wittry, and thrilled to be here to discuss how our division uses surveillance to support our environmental health specialists in their work. But before we do that, we're going to start with a poll. So you should see a poll question up right now on the screen. It reads, which of the following is not one of the root causes of foodborne illness outbreaks? Is it lack of customer seating space? Is it lack of food safety processes? Or is it lack of equipment? So we'll give you a minute or so to answer that question. All right, looks like polling has closed. Oh, look at all these smarties out here. So The answer is lack of customer seating space. So 90% of you answered that. And then we will be discussing lack of food safety processes and lack of equipment. So stay tuned. I do want to mention, though, lack of customer seating space could be a root cause potentially of a respiratory outbreak too. So, for those of that didn't answer that, I can see maybe your train of thought. All right. So as an environmental health officer, I translate environmental health data into actionable prevention strategies. And today I'll be sharing data from Clostridium perfringens outbreaks that occurred in retail food establishments and how this information is used to advance food safety practices and policies. So first, let's start with a short overview of foodborne outbreaks and components of an outbreak investigation. Next slide, please. So as a reminder, most of our foodborne outbreaks are linked with restaurants. So because of this, the data I present today is focused on these types of retail food establishments. And throughout this presentation, I'll be using the terms restaurant and establishment interchangeably. But for your awareness, when I say establishment, I do mean restaurant. Next slide, please. Our health departments are responsible for food safety, but also may be responsible for a variety of other environmental health roles and tasks, as Dr. Brown mentioned. Environmental health specialists wear many hats to protect public health. They act as specialists at being generalists. So in terms of food safety, environmental health specialists investigate outbreaks, but also perform a range of other activities in order to ensure safe food. Environmental health specialists conduct routine inspections, perform plan reviews for new operations, which are designed to reduce the risk based on types of foods prepared, educate food managers as well as food workers, and provide consultative services. For example, if an establishment has a question or issue, the environmental health specialist can offer some public health guidance. For this presentation, I was focused on the environmental health component of the foodborne outbreak investigation, which we call an environmental assessment. Next slide, please. So shown here is our disease triangle. So just as you need a conducive environment, a susceptible host, and an agent to cause illness, you need our environmental health specialists, or epidemiologists, and laboratorians involved in an outbreak investigation. They all collect critical information to solve the outbreaks. So I'll be focusing again on the environmental health piece, but the goal of the environmental assessment is to understand how the pathogen was allowed to contaminate, proliferate or increase, or survive in the environment, in this case, the kitchen. So uncovering this information reveals the environmental causes of the outbreak and helps us identify the system failure that led to the illness. Next slide, please. Next, investigators determine why the pathogen was allowed to contaminate, grow, or survive in the environment. Researchers have theorized there are 5 categories that explain the outbreak root causes. They include people, equipment, food, processes, and economics. Understanding the root cause is critical to inform sustainable long-term control measures. Next slide, please. So let's next walk through a quick outbreak example where our investigators identified the what, how, and why. So first, what happened to make people sick? Investigators found that a sick food worker worked while experiencing symptoms such as vomiting and diarrhea. Now, how did this happen? Investigators discovered that this was due to contamination, which occurred by a sick worker touching ready-to-eat foods with their bare hands. And why did this happen? So investigators found that the manager did not train employees on their employee health policies to exclude sick workers from the operation. Now, this is a root cause around people. They also found that the worker reported a lack of sick leave for the reason for them working while sick. Now, this is a root cause of economics. So ultimately, this information informs our short and long-term corrective actions for the restaurant. By understanding some of these underlying barriers and facilitators for employee working while sick, we can prevent it from happening in this restaurant again. For example, the restaurant can have makeup shifts for when employees call out sick, so they don't have to lose that pay. And the restaurant can also provide more comprehensive training and reminders on the employee health policies. Next slide, please. Now, when we aggregate data from outbreak establishments, just like the example I presented, we will understand the system failures and their root causes on a national scale. CDC has used this kind of data to inform significant national food safety policies, such as the provisions in the FDA Model Food Code, which is the basis for state food safety laws, as well as outbreak investigation guidelines, such as the Council to Improve Foodborne Outbreak Response Guidelines, or C4, and even training, such as EATS, which Dr. Brown will present later. So these resources support health departments to implement practices to prevent the leading causes of foodborne illnesses. Next slide, please. Now, great news, we collect this data at CDC. So our National Environmental Assessment Reporting System, or NEARS as we lovingly call it, it collects this unique data on the outbreak establishments. So let's review specifically what kind of data is collected during environmental assessment. So during an assessment, our investigators visit the outbreak establishment and they interview kitchen managers and workers. They might be asking about different food safety practices, understanding how food is handled and prepared in the restaurant. They might ask questions about if someone had vomiting and diarrhea when they were working with food. They also perform observations, looking at how the food flows through the restaurant, also seeing if food workers are taking food temperatures during cooling and cooking processes, and what temperatures are they expecting. They also look at records and review them, such as logs that might contain temperatures for cooling as well as cooking, and they perform sampling for pathogens in the kitchen environment. So these data increase knowledge about our environmental context of outbreaks and allows us to identify the gaps in food safety policies and practices, as well as the types of establishments vulnerable to outbreaks. As a result, this data has informed prevention recommendations, which I'll focus on for the rest of this presentation. But let's dive into what we are learning from NEARS. Next slide, please. So we conducted a NEARS analysis to better understand the circumstances or root causes that lead to Clostridium perfringens outbreaks. And we selected this pathogen as it's the third most common foodborne pathogen and causes around 1 million foodborne illnesses each year in the United States. Now, you don't really need to know much about Clostridium perfringens for the purposes of this presentation, but what you do need to know is it's a bacterium found on raw animal products, and it produces spores that form a coating to help it survive cooking. And when food is kept at unsafe temperatures during cooking, cooling, and holding processes, the Clostridium perfringens can grow. Understanding the root causes associated with unsafe food practices that led to Clostridium perfringens outbreaks can help us prevent future outbreaks. Next slide, please. So our data set included 3 years of data from 2015 to 2018 with 34 Clostridium perfringens outbreaks across 10 NEARS sites. Our qualitative analysis focused on 2 open-ended questions from the NEARS instrument. So the first question was, were there any differences to the physical facility, food handling practices you observed on your initial visit, or other circumstances that were different at the time of exposure? Now, this question is asked in the observation component of the NEARS instrument and designed to identify those differences or unusual circumstances in the establishment operations during the time the customers were exposed to Clostridium perfringens. The next question is only asked if there is a food item implicated in the outbreaks, and it states, during the likely time the ingredient food was prepared, were any events noted that appear to be different from the ordinary operating circumstances or procedures as described by managers and/or workers. Now, these questions were the focus of our analysis because research suggests that unusual circumstances frequently precede outbreaks. And to get a comprehensive review of the outbreaks, many other quantitative NIRS data points were used to support these questions. This included information about the outbreak and outbreak establishment characteristics, which we will review next. Next slide, please. The primary outbreak system failure or contributing factor was pathogen growth and occurred while the food was at the establishment. All of our establishments engaged in complex food processes, which is a food preparation requiring a kill step like cooking and holding beyond same-day service, or a kill step and some combination of holding, cooling, reheating, and freezing. These processes present a higher risk for bacterial contamination, growth, and survival, as food is going through the temperature danger zone multiple times. Most of our outbreak establishments were restaurants and independently owned, and the majority served more than 100 meals per day on average and had a menu type classified as Latin cuisine. Many also had 2 or more critical violations on their last routine inspection, which means violations more likely to contribute to our pathogen contamination, growth, or survival. Next slide, please. We found people, processes, and equipment as root causes that precede Clostridium perfringens outbreaks. We identified a total of 9 root causes within these categories, and we'll be taking a closer look at the top 5 root causes that preceded these outbreaks. But before we do that, I do want to mention that while some of these causes seem pretty obvious, these issues continue to persist and people continue to get sick. Researchers recently found that improper cooling procedures and inadequate equipment are prevalent in the retail food industry. We need to understand why these are prevalent and why these continue to contribute to outbreaks. So let's discuss some of the practice gaps that contribute to Clostridium perfringens outbreaks. Next slide, please. Overall, most of our outbreaks had people root causes. The top root cause was the lack of adherence to food safety procedures and preceded 15 outbreaks. It is defined as food workers not following food safety procedures designed to control bacterial survival and growth. A quote from one of the investigators is, "The chicken was partially cooked, then stored at room temperatures, then improperly cooled, stored at room temperature again, stir-fried to order. In this situation, the food workers did not adhere to proper food safety procedures regarding the storage and cooling of food." Next slide, please. The next root cause is around process issues, specifically a process change during preparation, which led to the outbreak and occurred in 11 outbreaks. It is defined as the preparation of the implicated food item differed from the restaurant's normal procedure. Ultimately, this process contributed to food temperature abuse and pathogen growth. An investigator noted, managers said they were cooling with ice, but multiple large containers of food were found out of temperature in walk-in cooler. They hadn't cooled properly and were covered. This establishment changed the cooling process during preparation of the implicated food item, which led to the growth of Clostridium perfringens. Next slide, please. Number 3 is lack of food safety culture, which pertains to people root causes and preceded 8 outbreaks. It is characterized as multiple, consistent, poor food safety practices. Examples included a documented pattern of poor inspections, long-standing critical violations, and a history of outbreaks. A quote from one of the investigators is, "The establishment is in the exact same poor condition as during a previous norovirus outbreak investigation." Next slide, please. Number 4 root cause is around equipment, specifically an establishment not having enough equipment, which preceded 7 outbreaks. It is defined as an establishment did not have enough equipment or use inappropriate alternatives for food storage or holding. An investigator noted food was placed in cardboard boxes and transported without appropriate temperature control. In this situation, the establishments did not use equipment to control the temperature during transportation, which allowed for Clostridium perfringens to grow. Next slide, please. And our number 5 root cause has to do with equipment and is due to malfunctioning cold holding equipment, which occurred in 5 outbreaks. It is defined as equipment did not keep food cold enough to minimize pathogen growth. One of the investigators noted the walk-in was being repaired due to temperature issues on the meal date in question. It's likely that because this walk-in was being repaired, the temperature was too high to keep the food item refrigerated and resulted in pathogen growth. Next slide, please. And to summarize, data on outbreak root causes can inform food safety interventions to prevent future foodborne outbreaks. Restaurants and environmental health specialists can use this information to implement long-term control strategies. First, we recommend that restaurants and regulators educate workers about why food safety tests are performed, as this will help instill a culture of food safety and support use of sustainable and robust food safety management systems. Also, we recommend incorporating a risk management plan, a prevention tool used to prevent foodborne outbreaks and correct process failures, as this provides verification of food safety processes at restaurants. And finally, regulators and restaurants can train workers to use equipment properly and to determine when corrective actions are required to avoid equipment failures that contribute to pathogen growth and survival. I would like to thank all the near sites as they reported this valuable outbreak data. Obviously, the study couldn't have been done without them. And by reporting these outbreaks, they have contributed to the science and advanced the food safety practice. Also, I'd like to give a shout out to the co-authors of this study, Megan Holst, Nicole Hedin, and Janet Anderberg. And with that, I'll pass it over to my colleague, Thuy. Thuy, take it away.
Thanks, Beth. Hi, everyone. I also have a question for you before I begin. So let's bring up the poll. All right, so the question for you is, do you look for inspection results when deciding where to eat, specifically in restaurants? Yes or no? And answer honestly. We'll give you a few minutes. All right, the poll has closed. All right, so wow, okay, so 42% of you said you do and 58% of you said you do not. Wow, this is very interesting. So for those who don't look for these results, maybe I'll give you some food for thought for my presentation. With that, we will continue. So next slide, please. So research is an important tool that public health uses to identify best practices to prevent illness. The beauty of research is that every piece of research is like a thread that contributes to our understanding of food safety and, more broadly, public health. It is when these threads are woven together to form a strong fabric that we have foundations for improving public health practice and preventing foodborne illness. So today I'll be sharing results of our pieces of thread, our research on foodborne illness outbreak implications of restaurant inspection practices. And this research was funded by CDC through a cooperative agreement with the National Environmental Health Association. Next slide, please. So as Laura mentioned, there are an estimated 48 million illnesses linked to foodborne pathogens every year in the US. By investigating and interviewing some of these ill people, public health can gather clues about what is causing the illnesses, how it is being transmitted, and ultimately, if these illnesses are linked in any way to form an outbreak. With these clues, we can stop the spread of illness and prevent future illnesses from occurring. So what is an outbreak, you might ask? Next slide. According to CDC, a foodborne illness, back one slide. So according to CDC, a foodborne outbreak is defined as an incident in which 2 or more persons experience a similar illness resulting from the ingestion of a common food. Now, foodborne illness outbreaks are rare. However, these occurrences provide valuable learning opportunities for us to improve public health actions and prevent foodborne illnesses. Next slide. An important part of research is to look at trends in data. This graph from the USDA Economic Research Service is showing how the eating habits of people in the US have changed since the late 1980s. Foods prepared away from home, represented in orange here, has become more popular in the US, possibly in part due to the time convenience that these foods can provide. Now, in 2017, it was estimated that 53% of consumer food spending was for foods eaten away from home. Because of this, it became important for us to examine how public health can keep these foods prepared in these settings safe. Next slide. So our research focused on restaurants because they have been shown to be important settings for foodborne outbreaks or illnesses. Restaurants are included in that category of foods eaten away from home. And in 2017, the USDA estimated that 35% of spending on foods away from home was spent specifically in restaurants. That same year, there were 841 foodborne outbreaks identified, with 64% of those outbreaks linked to foods prepared in restaurant settings. Now, within public health departments are environmental health programs that send out inspectors to perform restaurant inspections. I'll refer to these programs as public health departments throughout this presentation, but keep in mind that restaurant inspections are performed by inspectors in the environmental health programs. These restaurant inspections focus on ensuring that safe food handling occurs in restaurants. And studying how these inspections are being conducted can give us part of the picture of the role that restaurants play in food safety. The more that we can see of this picture, the more we can improve how we protect the public from foodborne illnesses in restaurants. Next slide. So as I mentioned, health departments are responsible for inspecting restaurants, but throughout the US, there are many ways that they can conduct these inspections. Our study looked at 2 main characteristics of these departments. First is inspection grading methods, and then second, disclosure methods. Now, when we say grading, we mean they are assigning an indicator of their inspection results that basically tells how well the restaurant is handling their food safety. You can see this in the form of letter grades like ABCs that you would get in school. Some health departments also use numerical scores on a scale of like 1 to 100. Some use stoplight colors, so red, yellow, green, and then some also use emojis, smiley face to frowny face. Some departments, however, don't assign a grade at all. And you know about these grades, how you know about them is through what we call active disclosure, which is the act of voluntarily and preemptively publicizing what we call, publicizing some or all of the inspection data to the public. This means the health department publicizes that inspection data for consumers to see without being asked first. If public disclosure is required, you would see the scores in places like inside or outside of the restaurant or online. And similar to grading, some departments don't require disclosure at all. Next slide. So now that you know what grading and disclosure mean, I'll give you some background on how those have been examined. Previous literature have shown that there are relationships between restaurant inspection practices like grading, like disclosure, and improvement of public health outcomes. In 2005, Simon and colleagues found a 13% decrease in hospitalizations in Los Angeles County associated with implementation of their restaurant hygiene grading program. Now, one study that demonstrated the value of public disclosure was from Shea and Scharf, who found that inspection scores improved by 1.14 points out of a possible 100 points when disclosure occurred at the restaurant in Ohio. Another was in New York City, where Firestone and Hedberg found a 5.3% decrease in salmonella infections per year after public disclosure at the point of service or at the restaurant was put into place. In addition to finding improved sanitary conditions as an impact of the New York City letter grading program, Wong and colleagues also conveyed the importance that these grades had for consumers, reporting that 88% of New Yorkers that they surveyed considered these inspection grades when making their dining decisions. Next slide. So using that research as our foundation, our study aimed to identify if certain grading and disclosure methods were more beneficial to public health than others. We did that by evaluating how these practices affect foodborne illness outbreaks, but more on a national level than the foundational literature that I just covered. Next slide. So we conducted our study in 2020, and we used two sources of information. First, we sent a survey to 790 health departments across the US. We asked them how they graded inspections, how they disclosed that grade to the public, and how many foodborne outbreaks they investigated from the years 2016 to 2018. This survey gave us our first outcome rate of average number of foodborne outbreaks per 1,000 restaurants per year. The second source of information came from CDC's Foodborne Disease Outbreak Surveillance System. State health departments report their outbreaks each year to this surveillance system, and that information is published to the public. We wanted to see if this CDC data supported what we were seeing from that survey data, and if it did, it would strengthen our initial findings from that survey data. And because, having two sources of information can be a little confusing in one presentation, throughout the rest of this presentation, you will see an icon in the top right corner to let you know where the data are coming from. So this clipboard icon represents data coming from our survey, and then the computer cloud icon represents the CDC data. Next slide. So here are some general characteristics of our survey respondents, most of whom we recruited using the FDA Program Standards listserv. We had a total of 140 respondents from local departments, which means that they operated at the city-county combination or district government levels. Our study focused on these local departments rather than state departments because most inspections occur at this local level. Our respondents were from 34 states, representing all regions of the country, as you can see on this map. Each of the states in yellow had at least one local department represented in our data, with a median of 3 departments per state and then 1 to 14 departments per state as the range. But the important thing here is that having this diversity represented in our data is really important because it allowed us to see a broader picture of how grading and disclosure were being done. Next. Okay. Almost all of our respondents were local health departments that conducted routine follow-up or re-inspection and complaint inspections at restaurants. About 66% of our respondents actively disclosed inspection results to the public, with the most common methods being posting online and at the restaurant. As I mentioned before, some departments do not disclose, and 32% of our respondents reported that they don't. Now, 71% of the departments graded routine inspections, with the majority doing so using a numerical score followed by letter grades. Many use both numbers and letters to summarize results, but as I've mentioned, there are a lot of other ways that grading can be done, if at all. And about 24% of our respondents indicated not summarizing inspection results with grades. Next slide. So these are the results from our survey data. First up is the average number of re-inspections performed per restaurant per year. Health departments that graded routine inspections reported conducting about 37% fewer re-inspections than those that did not grade at all. And departments that disclosed at the restaurant reported 15% fewer re-inspections than those that disclosed online only. Therefore, grading and actively disclosing that grade to the public may reduce the re-inspection workload for some health departments. The next rate we calculated was the average number of complaints per 1,000 restaurants per year. There were 22% fewer complaints for those that graded and 38% fewer complaints for those that disclosed at the restaurant. In orange is our main outcome of interest of outbreaks per 1,000 restaurants per year. Departments that grade reported 61% fewer outbreaks than those that did not grade, and those disclosing at the restaurant reported 55% fewer outbreaks than those that disclosed only online. And then lastly, in the yellow column is the average number of salmonella cases per 100,000 population served per year. I mentioned that outbreaks are relatively rare, and so we wanted to see if the same trend we saw for outbreaks was present on the sporadic case level, and we did see that. So departments here that graded reported 25% fewer salmonella cases than those that did not grade, and then departments disclosing at the restaurant reported 12% fewer cases than those disclosing online only. Next slide. So those were the results of our survey data. And so now I'll share with you what we saw when we looked at the same departments, but using the CDC data. First, let's talk about the average number of foodborne outbreaks per 1,000 restaurants per year by grading practices. That top row in the table is the rate of outbreaks for departments that did not grade. You can see that's about 0.96. So compared to these non-grading departments, those that used letter grading reported 68% fewer outbreaks, and departments that used numerical score reported 39% fewer outbreaks. Next slide. So next is active disclosure practices. In that top table, you can see that departments that did not disclose inspection results to the public reported about 1 outbreak per 1,000 restaurants. Compared to these departments, those that disclosed at the restaurant reported 71% fewer outbreaks, and those disclosing online reported 30% fewer outbreaks. Now, because we know a large proportion of departments do both, we broke it down further in the table at the bottom. So here we compare departments that disclosed at the restaurant and those that disclosed online only. We found that departments disclosing at the restaurant reported significantly fewer outbreaks than those disclosing only online. Next slide. So to summarize our outbreak outcome in one slide, our study showed that departments that grade reported fewer outbreaks than those non-grading, with estimates of 61% fewer according to the survey data and 31% fewer according to the CDC data. Disclosure was associated with fewer outbreaks than non-disclosure. More specifically, though, departments that disclosed inspection results at the restaurant had 55% fewer outbreaks than those that disclosed online only, according to the survey data, and then this estimate was 63% fewer from the CDC data. So as you can see from this summary, there was some consistency in our findings from the multiple data sources that we had, which adds to the strength of our study. Next slide. So just a few more strengths of our study include our use of a common rate of outbreaks per 1,000 restaurants, which allowed us to compare these grading and disclosure practices across jurisdictions, and our ability to use that national outbreak surveillance data from CDC to validate the results we saw in our survey. One thing I hadn't mentioned was the fact that our survey respondents reported almost a quarter of all the restaurant outbreaks reported to CDC for our years of 2016 to 2018. This told us that our outbreak data captured a good portion of the total restaurant outbreaks that were being reported nationally. Now, limitations to our study include use of a convenience sample and online recruitment method, which somewhat limited the representativeness of our results to enrollees of the FDA Program Standards program. This study did not adjust for potential confounders such as jurisdiction size, geographic region, state level inspection and reporting requirements, and funding and staffing levels of the Environmental Health Department. We do acknowledge that these factors may have affected a department's ability to investigate consumer complaints, detect outbreaks, and then subsequently report them to CDC. Next slide. So in conclusion, our findings from both the survey and CDC data against the backdrop of the existing literature on these practices suggest that grading inspections and posting those results at the restaurant may be effective interventions to reducing the occurrence of foodborne outbreaks associated with restaurants. One of the novelties of our study was that incorporation of that national surveillance data from CDC to validate our survey data. We think that this approach can be a powerful tool to identify best inspection practices to help prevent foodborne illnesses and outbreaks in the future. Next slide. And then I would just like to thank first and foremost our survey participants who shared their information with us for this study. And also equally as important are the individuals listed here for their contributions to this work. Thank you all. And now I will turn it over to Dr. Laura Brown.
Thank you. And thanks to both Ms. Kim and Lieutenant Commander Wittry for presenting on our division's work in the area of outbreak surveillance and our research on restaurant inspections. And I'm going to close this out today by just sharing a little bit of information on our training initiative. Next slide. As Lieutenant Commander Wittry has explained, environmental health data from foodborne outbreak investigations are really key to helping us think about preventing foodborne outbreaks in the big picture. And CDC really values these data. That's why we collect it through NEARS. So we also provide training on how to collect these data, how to collect high quality data. And we do that through this training series, EATS. Next slide. Not surprisingly, given what we've talked about today, this training is designed for environmental health practitioners, specifically those that investigate foodborne outbreaks in retail establishments. Next slide. EATS provides training on this environmental health component. This training is free, it's interactive, and it includes the opportunity for earning continuing education units. Next slide. And this training focuses on real skills that are needed during investigation. And these include those listed here. There's a module on interviewing. How do you interview managers and employees in restaurants to get more accurate information about how foods are prepared, whether anyone has worked while sick? This information can be really valuable in understanding failures in the food system processes. There's also a module on observation, for example, reviewing records, taking temperatures of foods, and then a more specific module on conducting a records review. For example, you might want to review employee logs to see if anyone had called in sick, or you might want to look at logs of temperatures of foods taken throughout a time period. And in some outbreaks, sampling the environment can be instrumental in determining the pathogen and how it got into food. So there's a module on that. There's a module on creating control strategies. One of the key things that environmental health practitioners do when they're investigating an outbreak is try to figure out what's happening so that they can stop it. So there's a module on what those control strategies might be. And then lastly, there's a module on critical thinking. A comprehensive outbreak investigation collects a lot of data, and synthesizing those data and trying to make sense of it really does require critical thinking skills. Next slide. Now, as I said, this training is interactive. And here you see a screenshot from one of the interview exercises. So the learner gets to choose questions to ask a food worker. So this is an investigation of a norovirus outbreak. And there's a list of question categories you see here. The training learner can select a question to ask, and then the food worker will answer it. And then in real time, you get an assessment of the effectiveness of the question. The training gives you a sense of, is this the path you want to go down with a norovirus outbreak, for example? It's really pretty cool. Next slide. There's also a simulation of an observation. So here is an example of that. The learner can go into a kitchen and pick a food on the buffet, or every food on the buffet if they like, to take temperatures. Here they've taken temperatures of mashed potatoes, I think, and it shows you the temperature of 115 degrees. You could also take the depth of the food. And then after this observation, you again get an assessment of whether or not the questions you were asking were pertinent or going to take you down the right road for trying to understand the outbreak. Next slide. We've talked about why we've developed this training. We know that environmental health practitioners need to develop their investigation skills. They told us that in needs assessment and surveys. We also know that outbreaks don't happen every day, especially in smaller jurisdictions. So practitioners really need to have an easy way to refresh their skills. It's been a year since they've conducted an investigation. They can go take this training and brush up. Next slide. And of course, the big picture is we really want to help environmental health practitioners collect high quality data of these foodborne outbreaks. It helps them in the immediate outbreak understand what happened and then stop that outbreak from happening. But if we can aggregate all these data coming in from investigations all around the country, we can really start trying to understand and collect data that inform interventions and prevention at a national level. So we can use those data to inform national training programs and national food safety regulations. And I think Beth touched on this a little bit as well, Lieutenant Commander Wittry, excuse me. You can find EATS online. It's on our website. I'll leave the QR code up for just a minute. Again, it is free. You do have to register for it, but it's a pretty simple process. And I'll close this out by just talking a minute about what our EATS users tell us about this training. 9 in 10 users who took the training for CEUs agreed that it addressed a gap in their skills and that it effectively met their educational needs. And we administer a pre-test and a post-test with this training, and those data show us that users who complete the training show an increase in knowledge about conducting these environmental assessments of 40%. So it's a pretty substantial increase in learning. And then anecdotally, our users tell us that they find the training to be effective. I'm sorry, next slide. Our users tell us that they find the training to be effective and interactive, and that they really like it. So I think what we're going to do is do a quick poll, and then we'll move on to questions and answers. So our question is, before this seminar, were you aware of the CDC resources that we've talked about today? And you can just answer yes or no, and we'll give you a couple of minutes to do that. Okay, maybe 10 more seconds and then we'll close it out. Okay, it looks like about 62% of our respondents were not aware of our resources. I'm going to take this, I'm going to say that this is positive in that hopefully you can come away today with some information about the resources that we provide for environmental health practitioners. And I really hope that you go out and do some exploring. We're working hard to provide information that's useful to environmental health practitioners. And I think at this point, we're going to turn it over to Myron for Q&A. Is that right?
That is correct. Thank you, Dr. Brown, and thank you to our presenters. To ask questions using Zoom, please click the Q&A button at the bottom of your screen, and we will and type in your questions in the Q&A box. We have about just a few minutes left before this webinar concludes, so we will try to be as quick as possible. All righty, so Beth, and please forgive me if I butcher this name, but do the findings of C. perfringens outbreaks apply to all bacterial outbreaks?
Great. Thank you, Myron, for that question. So yes, it's possible for these findings on Clostridium perfringens outbreaks to apply to other bacterial outbreaks. Next, we plan to analyze our Salmonella outbreaks, but suspect to find many, the same underlying root causes, which relate to people, processes, and equipment that precede outbreaks. I also wanted to mention equipment issues could also be related to the root cause of economics, as financial challenges might limit an establishment's ability to buy new equipment or maintain existing equipment. So the role that economics plays in outbreaks is difficult for our outbreak investigators to evaluate, as they might not understand an establishment's financial situations and are likely unable to collect economic data like profit margins. So further research is really needed to understand and identify economic causes of outbreaks too. Thank you.
Thanks, Beth. Thuy, why do you think posting inspection grades in restaurants is linked to lower outbreak rates?
Yeah, that's a good question. So the idea is that because the disclosure of inspection results allows the consumers to make more informed decisions about whether they want to eat at a restaurant or not, it would then incentivize or motivate restaurant operators to pay more attention to their food safety efforts that they're doing in the restaurant, and thereby hopefully making it safer for patrons.
Thanks, Thuy. Laura, Dr. Brown, my apologies. Does CDC have restaurant food safety findings on other topics?
Yeah, so as I mentioned, we've done a variety of work in the area of restaurant food safety, and you can find all of that work, and especially we do plain language summaries of our findings so that you don't have to read a 10-page paper. You can read a 1-page summary of the findings. And they can find all of that on the website. And Myron, I'm wondering if we could pull up the QR code for that so people could take a look at it again. It was the first one I presented. But yes, you can find more of those resources on our website.
Awesome, thank you. Beth, is it free for health departments to submit their outbreak data to NEARS?
Yes, absolutely. It is free, and we would highly encourage you to submit your outbreak data to NEARS, as it shows us, what's happening at this bigger level, so we understand outbreak root causes and other factors that can influence policies and trainings and other guidelines. But we also provide an overview, training, and resources to support health departments really embed NEARS into their outbreak investigation procedures. And each training that Dr. Brown discussed and other resources, they're all free. So please see that QR code. We would love to collect your NEARS outbreak data and have you contribute to advancing food safety.
Thank you, Beth. I believe we have time for one last question. Thuy, given the research findings, do you think jurisdictions should make restaurants post their inspection results in the restaurant?
Yeah, and I think this will answer someone's question in the Q&A too. I would make that recommendation based on the research that we found, and also the literature that I had cited. We are seeing that, grading and posting that grade at the restaurant or just posting it somewhere for consumers to see so that they can be more actively engaged in their health. It has benefited the public health by, like I said, reducing outbreaks in our case, but also seeing that reduction in salmonella and also indicators of improved hygiene within the restaurants. And so I would encourage health departments to review that literature for themselves and then using that to make a case for getting grading in their jurisdiction.
Awesome, Thuy. Thank you so much. Thank you again for joining us for today's Nexus webinar with our special thanks to our presenters, Dr. Brown, Lieutenant Commander Wittry, and Ms. Kim. If you have any additional questions, you may email them to ehnexus@cdc.gov. Again, thanks again for joining us and have a great day.